I am Dr. Haveri, Consultant Orthopaedic Surgeon working in Jain Medical College, Belagavi. Today we are talking about osteoarthritis of the knee. It is just an educational video and not a treatment recommendation. Before going to osteoarthritis of the knee, you should know what is normal knee joint. So normal knee joint, you can see here, it is covered with at the end by an articular cartilage on both the sides, and these articular cartilage, they help in gliding and smooth movement of the joint. So osteoarthritis is degeneration of this cartilage. Degeneration of the articular cartilage is known as osteoarthritis of the knee. Next, coming to what are the causes of this osteoarthritis of the knee. The causes can be divided as risk factors. The risk factors, it is most commonly in obese patients, it is most common in elderly patients, and it is common in patients who have previous trauma. It is common in patients with a malaligned knee like genu valgum, genu varum. These knee can predispose to osteoarthritis. And osteoarthritis can be classified as primary and secondary. Primary means there is no cause for osteoarthritis. That is idiopathic, seen in elderly patients. That is a primary osteoarthritis. And secondary osteoarthritis is one which has pre-existing causes such as rheumatoid arthritis, gout, previous trauma, malalignment of the knee leading to osteoarthritis. These are the causes for osteoarthritis leading to secondary osteoarthritis. And types of osteoarthritis. Osteoarthritis can be classified as a mild variety, a moderate variety, and an advanced variety based on how much cartilage is destructed. How much cartilage is destructed on the femur side, how much cartilage is destructed on the tibial side. These are the types of osteoarthritis. And now coming for the symptoms. For what symptoms patient will come to the OPD? The most common symptom is the pain in the knee joint. The pain usually happens when the patient starts walking, going upstairs and downstairs, and the patient is exercising. Pain will appear and pain will disappear when taking rest. And in severe variety of osteoarthritis, pain is even there at rest. And second most common symptom is stiffness of the knee joint. The stiffness is due to fluid in the knee or swelling in the knee. That will lead to, that is also called as effusion of the knee joint. That leads to stiffness of the knee, and the stiffness of the knee can also be told as reduced movement in the knee joints. And sometimes patient will complain of the sounds coming from the knee joints, that is called as crepitus. And the patient will also complain of deformity of the knee joint. Some of the that we explain as genu varum or genu valgum. Also in layman's term we can call it as a bowing of the knee. And when we examine the patient, we see effusion, fluid in the knee, and we see tenderness in the joint, and we see the genu varum and genu valgum deformities we see in the knee joints. And when we move the joint, we see a sound, that is crepitus. And the patient's movements are also reduced. That is, range of motion is reduced. Then how do we diagnose such patients? I'll show you one of the x-rays. How do you diagnose osteoarthritis? First thing is x-rays. So what we do, we take x-rays of the knee joints in two views, anteroposterior and lateral view. What we see in the x-rays is reduction of the joint space. Joint space has reduced and new bone formation is there. You can see this is called as osteophytes. Osteophytes. Joint space is reduced. You can see joint space here more, joint space here less, and the subchondral sclerosis and cyst formation can be seen in x-rays. This is how we can diagnose the osteoarthritis. And other investigations, what we need is blood tests. For example, the CBC, that is the cell counts. We need it to differentiate other causes like septic arthritis. We need rheumatoid factor testing and anti-CCP to diagnose the rheumatoid arthritis, and we need serum uric acid to diagnose gout. These are the secondary causes for osteoarthritis. We need blood tests, and we also aspirate the joint, and that is called as synovial fluid analysis, and that is also helpful to diagnose cases such as septic arthritis and gout. And coming to treatment, the treatment we divide as a non-formal non-pharmacological treatment, then pharmacological treatment, and then a surgical treatment. Most of the patients, they don't want to come to orthopedician because they don't want to take medicines or they don't want to get surgery done. So they opt for non-pharmacological variety of treatment. The non-pharmacological variety of treatment is reducing the weight, then lifestyle modification. That means tell the patient to avoid sitting on the floor, avoid sitting avoid cross-leg sitting can be avoided. And then patient should be educated and he should be aware of what is the disease and what is the treatment. And next non-pharmacological treatment is he can be advised with a knee brace which he can wear whole of the day and he can remove at night. And next non-pharmacological treatment is patient can use a walking stick to walk, that will reduce his knee pain, and he can then undergo physiotherapy, that is hot and cold type of treatment for his knee. Then he can also undergo acupuncture type of treatment for non-pharmacological varieties. And the second form of treatment is a pharmacological treatment, where we give medicines such as the basic medicines such as paracetamol, which is available as crocin, dolo, they can be started with. And then the other medications are known as non-steroidal anti-inflammatory drugs such as the diclofenac sodium, ibuprofen, aceclofenac, then hydroxyl. And then the third variety of pharmacological treatment is they can start with the nutrients such as glucosamine sulfate, collagen peptides, and next one is they can get their knee injected with a glucosteroid, the steroid injections that will last for 4 to 6 months. And steroid injection patient can take for a period of he can take every 4 to 6 months, maximum of 3 injections in a year he can take. And the last thing in pharmacological treatment is a viscose supplementation, such as hyaluronic acid injections we give, and these injections will reduce the pain from 6 months to 1.5 years, those who don't want surgeries. And the last mode of treatment is surgery. In surgery also, depending on what grade the disease is, mild, moderate and severe. If the patient has grade 1 or 2 disease with a malalignment of his knee, such as varus knee, he can go into some osteotomies called as anti-well osteotomies. And the patient who has undergone MRI and who has been diagnosed with some meniscal tear, cartilage tears, he can undergo arthroscopic treatment where cartilage repair, meniscal repair and joint lavage can be given to reduce his pain. And in grade 3 and 4 variety, that is advanced disease, we go for joint replacement. I'll show you one of the X-ray of joint replacement. You can see here, this patient has got the medial joint space has been reduced, osteophyte formation is there, and in lateral view also you can see osteophyte formation, joint space reduction, and patellofemoral joint arthritis is also there in this. This same patient underwent this is a grade 4 advanced osteoarthritis, and the patient underwent a knee replacement where the articular cartilage has been replaced with the metal implants. These are made up of cobalt chrome alloy, and both the sides this is made up of titanium, and the spacer what we put is made up of a polyethylene, that is a special plastic what we use, and the patella has been resurfaced.